this pandemic has highlighted significant disparities in healthcare for populations, particularly individuals of color. And so, I'd love to explore this a little bit with you, particularly as it relates to cancer therapy and the disparity in seeking and access to equitable healthcare for patients of color. I'd love to get your thoughts on that.
The first thing to know is that there's a problem. So really the biggest thing we do at CDC is the epidemiology and the outcomes of cancer. What are those things that impact those outcomes? Access to care. One of the really interesting things about, if you're like the data and you have the data to look at things, is that every time there's a breakthrough in cancer care, the gaps get wider and wider in mortality, because those people who don't have access won't get treated. Those who do have access will, and survival differences and mortality difference get larger and larger. And so there's been quite a bit of work on that, looking at every breakthrough that the outcomes are worse and worse for those who don't have access. So that really is the first thing we do, is to bring attention to it. And then it's to work with people, let's say like our campaign for Prevent Infections in Cancer Patients, to educate people to know what they need to do to about side effects, how to get the care they need. And really it's about asking the questions that can get you the best care, to teach people how to do that. And that is, in the next project that we're doing with you all at Amgen, at CDC, CDC Foundation, is the Empowered Health. How do we empower people to understand what they need and then to actually ask for it? Understanding and asking are two very different things.
Yeah, that's a great point. So, I think one of the big gaps is addressing the inequalities in the delivery of healthcare, but a lot of this is informing patients, and I love this program, empowering patients to be an active participant in their care rather than a passive recipient of the care, and really giving people a voice, to be a partner. We're very proud of the partnership that we've implemented with the CDC, this 3-year program. So could you perhaps give a little bit more sort of details or the CDC's approach and the partnership to empower patients?
So it really is about understanding what people know already. So one of the surprises has been that a lot of people don't know that you can prevent cancer. So number one, we've got a heavy lift there. So when we asked the question in the focus group, can you prevent cancer? There was total silence. No one had anything to say. And so it's one of those things where, how did we sort of miss that? People understand the blood pressure, they understand diabetes, but they don't believe that cancer is preventable. So that's the number one challenge, which is huge, right? Then after that, how do you develop materials to help people understand what the next step is and how to do it? And how do you tap into the motivation? And that really, for me, is what Empowered Health is about, is how do you tap into the motivation of the person that you're trying to move their behavior in a certain direction towards cancer prevention. And some of it's, people know a lot, but it still doesn't help them act on what they know. So that's really I think the place that we've missed along the way in the research that we've been doing, and we hope to fill that gap.
This is a really important program, I think, and we've learned a lot, and I think the focus group and the literature review have really identified where the gaps are and what is really going to be needed to get a better understanding perhaps of how to facilitate that empowerment. And it was interesting, I think, that the review really showed that both patients and providers have an equal role to play in empowering the. This is not a provider only, and we certainly don't want to lay the burden exclusively on the patient, right? This is a shared partnership between the provider and the patient.
It's on both sides of the equation, as well as caregivers. That's the other group that we have to remind, that the people around you have a huge influence on what you do with your health. So not to forget those people as well. The last thing I would say is, regardless of who you are, we all want to take care of our health, regardless of who we are, race, ethnicity, socioeconomic status. We just have to be able, to help people find the resources to do it.
In addition, an opportunity to really stare into the disparities and make
Right.
sure that we are, moving to really overcoming the differences in healthcare disparities, whether it's racial, language,
Right.
socioeconomic, right? These are going to be key components of the program. I'm so excited about where we're partnering and the work that CDC is doing across the board in support of patients that are surviving cancer, as well as individuals at high risk. I look forward to our continued partnership.
All right. Thanks for having me.